Have you ever stopped to think about your oral health? Do you even know that the state of your oral health is a good indicator of your overall health? According to the World Health Organization, it is estimated that oral diseases affect nearly 3.5 billion people worldwide. The Global Health Organization also states that more than 530 million children suffer from dental caries of primary teeth, that is milk teeth. Treatment for oral health condition is expensive and usually not part of universal health coverage. In most high-income countries, dental treatment averages 5% of total health expenditure and 20% of out-of-pocket health expenditure. Joining us to discuss this is Dr. Olukayode Adeyanju, a qualified dentist who is a core specialist in cosmetic dentistry. Dr. Adeyanju, good morning. You're welcome to the show.
Morning. Thank you.
Good to have you.
Thank you.
I mean, it would be nice to have your thoughts regarding oral health. This is an aspect of health generally that many tend to not speak so much about. You know, other diseases take the center stage. But of course, as we have seen from what we read, 3.5 billion people worldwide, globally, suffer from oral, health and diseases. How are we coping? How are we dealing with this silent concern in Nigeria? I know that you are an expert in that area. Can you share your experiences with us, please?
All right. Thank you. Basically, oral health diseases, except for pain, which is dental caries, is usually non-communicating. That's one thing that most diseases that is afflicting the mouth. It doesn't communicate. It's what you can live with. And usually when disease does not communicate, we tend to take it as no problem. Just like blood pressure. Most people don't know they have BP until something serious happens. So, and the mouth is just one major that is afflicting humanity. And also because, we have 32 teeth, even if something is wrong with one of your teeth, you can always negotiate. If something happens to one part of your mouth, you run to the other side, So also, thirdly, the teeth is the strongest tissue in the body. So what will happen to the skin that you will scream will happen to your teeth, and you can still bear and you endure. So when you look at the profile of the mouth itself, so many people can negotiate and survive without having to see a specialist until a very, very bad stage. I think that's why most people do not really care much or respond to dental or oral problem at first instance.
Usually you've mentioned pain being one of the biggest or most popular indicators for when people will know perhaps there's something wrong. Maybe I should look at speaking to a dentist. What happens if you don't feel any pain, but you do see markers of something being wrong? Like, for example, if you brush your teeth, you spit out into the sink and you see that there's blood there. Is that a sign of something that you need to speak to a doctor about, to speak to a dentist about?
Oh, sure. Of course. Gum disease is one of the most prevalent diseases afflicting humanity. When you are mentioning about oral disease, I'm sure the real one is actually gum disease, which is the inflammation of the gum and the surrounding tissue at large. And it does not usually come with pain. One of the signs of gum disease is bleeding. When you brush, you see blood coming. But for a man that is trying to survive, somebody who has so many things on their table of order of scale of preference of needs. So when you want to pay school fees, you want to pay house rent, you need to have to fuel your car. When you look at various things that you are struggling, we just move on with your whatever is bleeding gone and you just neglect it. But really, it's a cause for concern. It's one of the cardinal signs for gum disease, and we say, and gum disease also, if I can just go a little bit further, affects the general body health. It's been linked to other things that can affect our general body health, even our life at large.
But is there data as to how endemic, oral health diseases are in Nigeria? Are people taking this, seriously? I know from what you have said that because it's not something that is communicative, you can hide it, you can mask it, and say, okay, I can do this later. I can, unlike, for example, things about your eyes that you need to wear glasses, and I'm not talking because I'm wearing one. I mean, there are ways that doctors will tell you, oh, your next appointment is in 3 months, is in 6 months. But for oral health, how endemic is the problem, especially in Nigeria or in Africa?
Well, okay, now first this part of health in Nigeria is grossly underfunded. Grossly. In the whole of Nigeria, we have about 179 higher institution, university, polytechnics, and tertiary institution, and only 10 offer training for dental. That is quite low. So one, we don't have enough institutions that trained. We don't have enough. In the whole of Nigeria, we have only 4,000 registered dentists to 200 million Nigerians. Can you see the gap? Now, thirdly, it's even in budgeting, you find out that dental and oral care is just like an adjunct of the general body health. So it's grossly underfunded. So there is not even enough money for research. When you don't even have money for the infrastructure itself, then there can't be money for research. So most of the things afflicting the industry or the dental care and oral is we don't have data. And because that is not available, it's a bigger problem. So we don't even know who has what and what cost was. So, and that's my area of interest, in which if in that area there could be something like an advocacy in oral care, maybe from the dental association, or a form of legislation that could make some basic things so that we can fund more and we can have a lot of data that can help people. Because without data and research, there cannot be solution, according to scientific approach. No data, no solutions.
Ultimately, one of the things that keep people away from accessing dental care is the price of it. You are, of course, a practicing dentist yourself. You have your own dental home that you use to cater to the public. What ways do you think more people who may not have as many means as your usual clientele, what ways do you think that there can be to, make it easier for more people to access crucial dental care, even if it's just checkups?
Excellent. I think also dentists in Nigeria are bad business people. We are bad businessmen. Economics tells of scales of demand and supply. Supply is high, then your price goes up. When you don't have, demands, but in Nigeria, you see, we don't have enough, and the fees are very, very expensive. I'm not advocating, but I would suggest that most dentists should make dental checks free. When you make dental checks free, consultation free, so it makes people at least have a window to come in. Even like in the US, some of even basic x-rays are free. So it encourages. So I think that's one thing we dentists would do. But unfortunately, you find out that even in some dental home, to see a dentist cost about 10,000 naira. And when you look at that, to pay 10,000 naira to see a dentist, if it's not painful and I can go up with my life, why not see the chemist shop next door, get my life, move on? And so I think one of the things we must do is actually to make dental consultation and registration more friendly, or at worst, free. And that encourages most people to come in. That's what we do in our practice. In DDH, if I can mention that here, we make our registration free, and it's for life. You come in 20 years, 18 years, anytime you come, it's free. So that encourages our patients to come back. So I kind of want to encourage most dentists to do that. That will help at least to attract. Then number 2 is also the funding from the NHIS. The National Health Insurance Scheme should also, in a way, make some basic for especially pregnant women. They should kind of make it free. if all pregnant women have access to go to the dentist, so at least that will encourage them once they're pregnant, so at least such thing. But when all these things are not available, it's make it a bit expensive and people don't go.
Dr. Adeyanju, I know that unhealthy diet and use of tobacco are, factors that contribute to bad oral health, your dentition and everything. But I'm also aware that bad use of alcohol is listed as one of the factors. And I'm wondering, alcohol? How does that affect your your oral health? What are we talking about here? Are we talking about beer or spirits, and in what specific ways? And if you would also like to expand, the first part of the question, further, don't you think that advertising plays a role, especially for kids, in the sort of unhealthy diet that lead to oral health and diseases, globally, not only in Nigeria.
All right, I think with dieting, when you talk to alcohol and tobacco and your oral health, the concern is gum disease.
Okay.
The concern is gum disease. Gum disease, like I said, is inflammation of the gum, and which usually it's chronic. It's like an average 8 out of every adult Nigerian has gum disease.
8 out of how many? 8 out of 10.
Every 10, yeah.
Wow.
That's from our
high.
It's high in our data, in our practice. That's, within a base, I'm sure you do periodontal checks and you find out, but it doesn't communicate, and most people don't care. And the cause is ineffective cleaning and also lifestyle. All right, ineffective cleaning and lifestyle. We encourage everybody should clean morning, evening, last thing at night. We encourage you should spend 2 minutes brushing every day, morning and night. Now, when you take tobacco, of course, that helps. That makes it worse. It causes vasoconstriction, capillaries. It causes problem that can be explained. But when you take alcohol, of course, what happens most of the time, spirit and alcohol, it's digestion is in your stomach. Then you can be sure on nights where you are high, I take alcohol. You won't brush at night. And for all you care that you have eaten, you go straight to bed. So it makes your case worse.
His doctor speaking from experience or from consultations.
So we say, hey, so that makes the case worse of brushing at night. And of course, most havoc of diseases that afflict the mouth happens at night. That's it, because when you are inactive and you sleep, usually we have bacteria who coexist in our mouth. They live with us, and they don't cause havoc until they are prompted. So when you whatever you take at night, you take something very sticky, you stick on the pits of your teeth. You have a lot of things you've taken, and you toothpick your mouth, you create some holes in your gums, and some things all stuck in your mouth, and you went to bed without cleaning them off. So when at night, these bacteria come around, and they begin to cause problems. So that's why we encourage you to brush at night. So in the cases where most often you never brush at night, that also affects. Then, of course, because it's established that gum diseases also can be associated with diabetes. The risk of diabetes can make it worse. So when you add all this together, we advise you to stay off tobacco and stay off alcohol if you want to live.
Dr. Adeyanju, I wonder if we could go back to basics. You've talked about brushing regularly, at least 3 times a day. It would be best if it's after every meal. But how do you think people should brush? Because let me not tell too many people's secrets. But I can imagine that, sometimes if you brush too hard, that's not too good. Is there an actual motion that's better? And then also people in rural communities who don't use toothbrushes and use pieces of wood.
Yeah.
What do you say about that? Yeah.
Well, quite honestly, there is a big gulf. There is a big need, because we occasionally go into rural and do corporate social responsibility. And you'll be shocked, even somewhere in Ikorodu, and you discover the level of ignorance in which people. No, so you can imagine if you go further into hinterland. So for people living in the city and for those who are privileged to hear me, of course, we encourage to say use soft brush, don't use hard brush.
Oh, I like firm brushes.
Most feel, okay, the harder, the better.
Yeah.
Then the more you use your strength.
Clean it quickly.
No. Soft, it's the bristles that cleanse. It's the bristles that cleanse. Then the new set of brush that have flexible head.
Okay.
Take note, there are some brushes with flexible head. They clean better at the back and the corner of your mouth. There are some brushes that just are very, very hard. It's not good. Maybe it's not flexible, the bristles, neither the head. So go for flexible head and very soft bristles. So I think then you brush away from your gum line. You brush with your mouth open. You don't brush with your mouth closed. You brush with your mouth slightly open. So that whatever you drop from the up into your mouth, from down into your mouth. But when you close your mouth, then you keep just making that motion. It's like motion without movement. So I think that's one of the things. Then spend 2 minutes. Then we say, okay, if you can have access to a mirror in your bathroom, also use a mirror guide to brush. That also helps you. And I think that's basic. But for those who use the chewing stick, then we need to do a lot of campaign. You say advertisement. Of course, the law. But of course, there should be room. I as a practitioner for about 30 years, if I can stand in advocacy, I think there just need to be regulations. But there's a big need at this point to really make sure that we make people to know about what they don't know. If there is so much of ignorance and you make a law that was made about 50 years or 60 years ago in the United Kingdom and is still just subsisting in Nigeria, and activists, the world has moved on, then we are just not living with reality here. So at this point, I think, I would say there is need for marketing and advertisement in the industry to make people know, but with very guided regulation. Just like in MBBCC, there's regulation in what you are doing in your profession. Yeah. So same here. So there should be, because there's a lot of people who don't know. I write in the papers, and I'm shocked that even top people, they come to know some things through what I write, and they will come and say, we never knew this. You guys should let us know. So I think there's a need for us to go out there, especially to save our children, because also diets have changed. You agree with me that what we was taking 30 years ago is not what our kids are taking now. Our kids' life is pretty much like what is happening in New York, in Paris. The world is now a global village. Yeah. Diet is pretty much the same. So we need to be alive to all these things and make sure that we save the teeth of our children. If not, they will pay dearly for it. And we will be responsible.
That's true. You were going to express a thought regarding chewing stick. I'm not sure whether you finished that one.
Okay.
So let's know what...
I hope you are not using one.
No, the Ijebu one.
No.
We didn't need to go there.
Okay, now, in school, they taught us that some chewing stick have antimicrobial effects. And they are very good. And it's been proven. So, we do, if we have anybody who uses that, we don't say stop it. It's tough to say stop it by an habit, either good or bad. But we'll tell you the good side of it. It's just that chewing stick may not be able to effectively do cleansing, but it helps in gum disease.
Okay.
I'll tell you that. It's very effective in gum disease.
Okay.
Not the Ijebu one. The one that is quite foamy. It's been proven. They've done, when I was in school, they did a lot of research and said it has strong antimicrobial, and it's recommended. So for those who are using the Ijebu, I advise you can continue your good job.
There's a business opportunity there. But where I was going, Doctor, is the issue of the desperation, if you like, for whiter teeth. Globally, it's becoming something very huge. Businesses, etc. And in this era of social media, you come across all sorts on social media, advertising something charcoal, something these, etc. Is there any danger that one should be careful about, the desperation, to have whiter teeth, etc.? What would be your, advice, in this regard?
That is true. I mean, everybody, of course, it's a world of graphics. We carry our phone around and we do selfie, you smile. So I think it's a booming business and it will boom for a while to come.
Indeed.
Now, you need to be careful about tooth whiteners. It could be, if you don't get it through the professional, cause havoc to gums. Yeah, it could cause serious havoc and burns your gums. So what we recommend is that it's best you don't too much buy off shelf. Even if you buy off shelf, before you apply, visit a professional. So the dentist will guide you. I understand a lot of people do it now in Nigeria, even some beauty shops all around you. So I think it's a bit on the extreme. One has to be a bit cautious because it's an health device product. So it's best being dispensed by somebody who knows the do's, and the don'ts and the caution. Is
that sector being regulated, though?
Well, it's not quite. It's seen now. It's like seen as cosmetics.
Okay.
It's getting to the realm of cosmetics because we see a lot of cosmetic people buying it off shelf and doing it. So even more than some dentists do. So I would say a word of caution here. Anybody who wants to be a bit more, it's just best to ask your dentist and say, okay, and we do it like a practice. It's best also done in the dental home.
Okay.
That's what if is best. That's why you instant tooth whitening. You spend about 15 to 20 minutes. You see somebody professional, they do it for you. It's safe. But all the one you buy and use and do at home comes with so many disadvantages that the person who sells to you will not tell you.
Okay.
Well, we have a couple of minutes left.
Yeah, just
until the end of our show here, and it has definitely been a very informative topic. But I wonder if we can go over a few more basic things.
Okay.
And I'm still on the actual process of brushing your teeth.
Okay.
What are your thoughts on the washing of tongues? Because you'll be surprised how many people do not brush their tongue, and that is why I prefer a firmer toothbrush, because I feel like when I go in for the tongue, it gets a more rigorous clean.
Okay, Femi, that's what they call it. Tongue brush. There's a tongue cleanser. There's a tongue cleanser, right?
They're very soft though, Dr. Adeyanju.
No, not toothbrush.
Okay.
Yeah,
those sit on the back of the toothbrush
Exactly.
Those are soft.
The cells on your tongue are not. The tongue is the most vascularized part of the body.
Okay.
And the cells are very, very, very soft. So I don't think it needs a hard brush for me. I don't think so.
You're the professional.
Of course, most of us feel good when it.
Yeah.
But the truth is, yes, and also the tongue carries the highest portion of bacteria in the mouth. So for those who don't cleanse their tongue regularly, they are highly predisposed to bad breath. Highly. And also, that's also, when you don't brush at night, there is a chances that you have a build-up overnight and you have this early morning bad breath. It could be dangerous for, for husbands, at times when your bad breath.
And wives too, please. Let us not forget the women.
So we encourage, make sure you brush at night before you go to bed. So soft toothbrush, brush your tongue, brush your teeth, open your mouth, 2 minutes, morning and evening. Rinse that very well. Don't use too much of stripes of paste. When it's too much, it gets too foamy, then it will make a mess of your brushing.
Mouthwash, would you recommend mouthwash as well?
Natural mouthwash. Best one is warm saline mouthwash. That is nature mouthwash is best. Because most of the mouthwash also carry some alcohol base and which also have adverse effects. Some have stains, chlorhexidine, it also had adverse effects.
Okay, very, very quickly, Dr. Adeyanju, because we just have barely a minute, to go. What will be your recommendations or your advocacy to government as per this sector of the health institution?
Excellent. It's quite honestly, I would want a situation where NHIs will at least put some dental care as primary dental care.
Okay.
That will help to boost funding for that sector of health, and that will change a lot of situations. Like right now in our practice, we need a lot of staff. We want to hire, but we don't have enough people. We have no people, and why is funding? So if any HIS could make some primary, like to see your dentist when you are pregnant is primary, so whereby they can give dentist capitation, then now they have more money, then that will help the industry. So I think it will be also a case of legislation also, and if they could just change it, a bit of the law, and I think it will be better for everybody, Nigerian, and for everybody.
So let's hope that Saudi Arabia and other countries have not snatched.
I hope I won't change my mind and travel out.
Dr. Olukayode Adeyanju, thank you very much for joining us. Dr. Adeyanju is, of course, thank you very much. He's a qualified dentist, and he's also a guest columnist in the Sun newspaper on dental care. Thank you very much for joining us. He's also, in case you didn't know, a core specialist in cosmetic dentistry. Thank you for joining us.
Thank you.